Hello, my name is Dr. Kim Wiebe, and I am a MAID assessor and provider in Manitoba. I will be speaking to what the MAID application process looks like in Manitoba. In Manitoba, we have a medical assistance in dying team that provides service throughout the province, including both in community and in facility. To arrange for an assessment for eligibility, you can contact the Medical Assistance in Dying office, which is based in Winnipeg. Our contact numbers are area code 204-926-1380 or toll free at 1-844-891-1825. You can also email us at MAID, M-A-I-D, at sharedhealthmb.ca. And we have a website that has information, including a submission form that you can submit directly from the website. The website is sharedhealthmb.ca/services/MAID. As well, our fax number is 204-940-8524. We accept referrals from healthcare providers and also direct referrals from patients and family or friends. After you contact us, an administrative assistant may reach out to gather some general information, and this will be followed by a call from one of our nurse coordinators who will do a preliminary triage over the phone. And that will be followed by a request for and review of medical records. And then if your medical condition does meet criteria for assisted dying, we will arrange for the 2 physician assessments required by law. We can also facilitate all of the documentation that the law requires. Everyone who applies for medical assistance in dying in Canada, including Manitoba, must complete a written request. If the patient is not able to sign the form themselves, another person can sign the form on their behalf, as long as they meet the criteria in the law. We can explain this process to you. Essentially, somebody helping you complete the form cannot be anybody that would benefit from your death. The form needs to be signed by the patient in front of a witness. The witness also cannot be anybody that would benefit from the patient's death and cannot be anybody that owns or operates a healthcare facility where the patient resides. The witness can be somebody who is paid to provide health or personal care to the patient. If you're having difficulty finding a witness for the request form, the Medical Assistance in Dying office team can help arrange for a witness, including connecting you with Dying with Dignity, who has volunteers that can provide witness support. The request form in Manitoba can be found on our website. We can also fax or email or mail a copy to you. After the form is completed, we will work with you to arrange for a copy to be sent back to our office. The law requires that patients asking for help to die in Canada, including Manitoba, meet with 2 physicians or nurse practitioners for assessments or eligibility reviews, as we call them in Manitoba. In Manitoba, we do those eligibility reviews as a mini team with a physician, a nurse, and a social worker at each of the 2 eligibility reviews. We can do those eligibility reviews in person, and sometimes we do them via telehealth or on the computer using FaceTime or Zoom. During those eligibility reviews, we will talk to you about your medical condition, including treatment options and options like palliative care. We will also ask you why you are asking for help to die, and if there's anything that would change your mind. We will also review how assisted dying works, including the medications that are used and completion of the death certificate after you die. It's important that you know that you can change your mind about having help to die at any time during the process, including immediately before we give the medications that will help you die. The actual procedure to help you die can take place pretty much wherever you as the patient are, including home or facility. There are a few hospitals and nursing homes in Manitoba that do not allow assisted dying, and we do have a process in place to arrange transfer to another facility if that is the situation with you. At the time of the procedure, we will meet with you alone to make sure that you still wish to go ahead and remind you that you are free to change your mind at any time. If you do still wish to go ahead, there is one more form to be completed. Again, if you're not able to sign the form, somebody else can sign on your behalf. The current law does require that you give a final yes or no immediately before you receive the medications that will help you die. There is the option of completing a form before the procedure date to allow us to proceed with helping you die if you become confused and not able to give a final yes or no that day. We would talk more about that form called a waiver if the situation applies to you. The procedure involves the use of intravenous medications. The nurse that is there that day will start 2 IVs. We use one and we like to have a second in place as a backup. If you do still wish to go ahead with help to die that day, we would give you 3 main medications through the intravenous. It takes 5 to 10 minutes to give all the medications. Most patients lose consciousness in the first minute, after which you aren't aware of anything. After you lose consciousness, you'll stop breathing, and a few minutes after that, your heart stops and you die. It is a very peaceful and gentle death. There is no gasping or moaning. There's no movement of the body, and you do not lose control of your bladder or your bowel. You can wear whatever clothes you'd like, and usually you can have whoever you would like with you, recognizing that at the time of COVID, there may be some restrictions to the number of people that can be present with you. After you die, the doctor who has given you the medications will complete your death certificate, indicating that you've died of natural causes related to your incurable condition that qualified for assisted dying. All life insurance in Canada pension benefits remain valid. You should be aware that the MAID team in Manitoba is only available Monday to Friday, daytime hours. As well, it does take a few days to arrange to come to do the procedure. We do try to come as soon as possible, but it does take a few days from when you're ready to choose a date to when the team could come. So the more notice we have, the better.